So Dave, what brings you in here today?
I've got aches in my elbow and lower back.
So aches in right elbow or both elbows?
Both.
So is it aches in, is it more in the right as compared to left, or is it both?
It's about equal in both.
So aches in both elbow. For how long have you had this?
Probably a good year and a half.
Year and a half? Really? All right. And where else do you hurt? In your
lower back.
lower back? And
Kinda
for
right.
how long you been having that?
Probably about the last 6 months.
6 months?
About the same time the elbows, because I said something to you about a year ago.
So it has been going on for a year?
Yeah.
Okay.
You had,
So your back has been bothering you for a year, right?
Yeah.
And so how severe is it on an average? How would you rate from a scale of 0 to 10?
Sometimes 6 to 8, sometimes 5 to 6. It
Okay.
just depends on how long you've been squatting or sitting or.
All right. So are you hurting right now?
Not bad, but I can tell it's there.
All right. So how much is the pain right now?
Probably about a 2 or 3. Nothing. I know
So-
when I go to stand up here, it's gonna.
Okay, can you stand up and tell me how much is the pain?
Yeah.
How much is the pain?
Yeah.
How much was the pain?
About an 8.
About 8? All right. You can sit down.
Can I walk around for a minute?
Okay, yeah, you can walk out for a minute.
When he's at home, when I'm at my mom's house and I watch him get up, there's times where it's very scary, and we kind of laugh at him at times because we're like, oh, you old man, just joking around.
Right.
They call it the dad walk.
And he hunches over in
Uh-huh.
order to stretch that back out.
Hunches
And
over.
he walks a few steps as he's hunched over, and then he finally
Yeah, I
stretches
got
out and gets it up.
at least 3 or 4 steps before I can stand straight.
All right. So Dave, what have you been taking for your pain?
I've got a variety of stuff. Ibuprofen.
You take ibuprofen?
Mm-hmm.
How much do you take that?
I'd be scared to tell you the truth. It depends. I probably won't eat none. Like I'll probably eat like 2 when I first get up,
Uh-huh.
just to get able moving around.
Uh-huh.
And I try to hold off until I can go to work, and then when I go to work, I'll probably eat 2 more.
Okay.
And then on both lunch breaks, I'll probably eat 2 more.
So on an average in a particular day, how many are you taking?
6 to 8, probably. Yeah, and then if that ain't working, I've got like some Tylenol extra strength.
Tylenol extra strength, okay. What else?
And
How
that's-
much do you take Tylenol extra strength?
Those I don't. I would say 4 in about a 12-hour day, maybe 4.
So 4 extra strength Tylenol a day.
Mhm.
So that comes out to 2 grams of Tylenol a day. Right. So for how long you've been doing like that?
Probably a good year.
How come you never called me about your pain?
I think his mom has arthritis really bad, and he thinks it's just arthritis related.
That and just being in the factory, I'm just not using. I've switched jobs in the last year,
Uh-huh.
so I'm just not using the muscles that I normally use there. But I'm still using my muscles, but just not the same ones. So a lot of it, I just contributed to just getting old. I'll be 50 this year, and I just.
So do you think 50 years is old?
No, I feel like I'm 20. That's what makes me mad, because I feel like I can do anything I want to do, but my body tells me different.
So that is the reason you never reached out to me?
I've said something in the past, but I just attribute it to being on 3rd shift and
Okay, fair enough.
not just aches and pains. I just
So you didn't ask help of your nurse daughter?
Well, yeah, she tells me to take ibuprofen.
She tells you to
because
take
ibuprofen is supposed to be the inflammatory thing. Yeah.
Right.
Otherwise,
Okay.
I'd be eating a Tylenol. So that's why
All right.
I switched from one to the other. But
Got it. All right. So you're sitting like this. I'm going to change you, make you sit straight. Sit like this. Bring your chest up and bring all the way up. Can you scoot a little bit forward so that, yeah. And now correct your posture. Sit upright and tall.
and talk.
Yeah. No, don't talk. Just sit like this. Yes. Bring your chest up and keep on sitting like this. What is happening?
I I can feel it in that lower back.
Right. Is it hurting?
Uh-huh.
Is it hurting more?
Not more, no.
Is
I
it
can
better?
feel- What do you mean by better?
Like, is the pain better than before?
It's not as strong.
So has it improved?
Yeah,
What does that tell you?
that I slouch.
Yeah. So what does that tell you? That if you will sit upright, your back is telling you that it is hurting less, right?
Uh-huh.
So I want to share with you why that is happening. So we have a curvature here above our buttocks. There's a curvature in the spine. We call it lordosis, okay? And that lordosis is very important for the health of our spine. So if that lordosis goes away, if I'm slouching or if I'm bending forward, see it goes away?
Uh-huh.
And when that hollow goes away, it increases the disc pressure and it decreases the stress on the ligament and the stress on your spine.
Okay.
And that increases the pain. That's why when you are fixing that washer, you're bending down, that lordosis go away, and that's why you hurt so much.
I've spent about 30 years bent over. That's
Right.
what's-
So just by sitting straight, you are bringing the hollow back in. And how's your pain now? You've been sitting for 2 minutes now.
It's not near as bad.
Stand up now.
Yeah.
Yeah, keeping the hollow in. Stand up. How was that?
Not near as bad.
Dave, so you've been lying here for 5 minutes, right?
Mhm.
I want to raise you now on your elbows. So why don't you put your arms here and just raise the top part of your body on your elbows. Can you lay on your elbows? Can you show us? Yes, very good.
Get him to the center. Oh, yeah.
What is happening?
The higher up I go, I can feel it in the...
Which is fine. I just want you to relax.
Right there.
Yeah, I want you to relax. And can you stay in this position for 5 minutes?
I can try.
And if it gets really painful, you can come down, okay? But we will keep you in this position for 5 minutes. All right?
Okay.
Okay. All right, Dave, so you have been like this, you took a break, you've been like this for 10 minutes now?
Yeah.
And how are you feeling now?
Better.
So I think we have got we will try to progress. Why don't we move up, put your hands here, put your hands here, and why don't you go up, all the way up, or whatever you can do.
Yeah, well... Oh, that hurts.
Good job.
That
You-
hurts.
I know, it hurts. Go down. You can go all the way down.
Oh, my God. Oh. That, doing that, you can definitely feel it in the elbows. I just done too much work in my life, and I've just accepted the pain, I guess.
Well, no more from now on. I think you will be pain-free. We have to, it's going up.
Yeah, if I lock them elbows in, that's when they hurt.
Yeah, go back. Don't bend your knees and go back as much as you can.
I got me.
All right, so you have done few extension in standing. So how do you feel, Dave, now?
I feel like I did a workout.
Yeah. How's the pain?
Not like it is when I first came in.
Why don't you sit down and stand up and see how you are doing with your back?
Easy to sit down ain't too bad. Now, if I do like you're saying, chest out and stuff,
Mm-hmm.
when I do that, I can feel not really a pain, more of just a twinge,
Right.
you know, I guess you could say.
Right.
But the severity of the pain is not there
Okay.
when I do it.
Okay, good. Can you stand up?
Like with my chest and stuff out, like you
Uh-huh.
want the curve.
That's how you will get up from now on.
That's not bad.
All right. So we will do.
I'm not like this.
Yeah.
That's for sure.
Yeah. Good. So you will do this. You will do 20 reps of lying exercise and 20 reps of standing exercise every 2 hours. And when you are sitting, you will slide yourself at the edge of the chair. Yes. And now lean forward and you will put this roll above your waistline in the small of your back. And now you sit up. Does it help you sit up straight?
It forces, yeah. I don't actually feel that bad there.
Yeah.
That actually, it makes you do that curve thing.
Right, right. So it helps you sit straight and it is
So I
not
can
that
feel it
strenuous.
right here.
Yeah.
I can feel a difference right here. You know,
Mhm.
like you're aligned, I guess. I'm not
Mhm.
sure how you want to
Yes,
say it.
exactly. That is the correct word.
Well, my shoulders don't feel like
They're rolling
Yeah,
forward
yeah.
or drooping forward.
Yeah.
Yes, exactly.
It's like it's forcing them to be pushed back.
Yes. But I want you to sit up straight, and at home you are going to use that. So at home you are not going to sit in a sofa couch, what you normally have been doing.
Okay.
So you will get a dining room chair, and you will use this lumbar roll, and that's where you will watch your TV from now on. All right. So Dave, I want you to sit up straight, and now I'm going to send you home with a neck exercise which I think is going to help you. Now move your elbows and see if you feel any difference.
I can go up higher with them before I feel the pain.
So I want you to sit up straight, and I want you to do this exercise. So look at me. You will tuck your chin in like this. See, look at me. Go back. So it is as if somebody comes in front of your mouth with a bad breath. Yes, you make a double chin and then relax and then go back. So is it any different since you did your neck exercise?
Yeah, yeah. I
Are
can
they
close
hurting?
them. No, I can close them further.
Mhm.
Like right here is not bad,
Mhm.
but if I go any further, I can feel it.
Go further.
But you don't. That's as far as it's gonna go. 'Cause my
Okay.
arm-
All right.
But yeah, it used to pull like right through there.
And now it is not pulling. Okay.
Not like it was when I first got here.
So what does that tell you? What you are supposed to do at home?
I guess stretch my neck
Yes, and you
Stretch
will
my-
sit straight. Okay.
because I'm always going like this a lot of times.
Right.
That's
So that will be your exercise for your elbows. Okay. And
just
I'll
do the in and out on the neck.
just in and out.
20,
20 reps every 2 hours. So that's what you will do, and you will do the back stretches in lying, back stretches in standing. You will use the lumbar roll. You will maintain your posture. You will stop all your ibuprofen. No ibuprofen at all. No Tylenol at all.
Okay.
Because I want to interpret your pain behavior.
You want to what?
I want to listen to your body. I want to listen to your
okay.
pain.
Okay.
So if you are hurting too much, I need to know.
Okay.
Then you will call me and I will reassess the situation. But right now, that's what you will do, and I'll see you in a week.
Okay.
Okay?
All right. Thank you.
All right, Dave. So you are here after 3 weeks now. You couldn't come last week. And last time I saw you for pain in your both elbows, which you had for a year. And you were having low back pain, which you also had for almost a year. So I want to visit with you. You are here second time. So how did it go since you started doing the exercises from the beginning?
At first, when I first started doing them, I noticed like when I left your office last time, I was stiff. I mean, it was like getting out of the chiropractor's office. I had a hard time getting out of the car and walking to the house. I could tell I did something that I'm normally not doing, but after I started doing like the first 2 or 3 days, it kind of stiffness stuff went away, and I could sleep better at night. It's just you're not. I say you're not dealing with the pain. You know, the pain's kind of it's just not there really. I mean, you still kind of want to take your aspirins because you're just used to it. You know, so that kind of instead of taking as many as I was, I kind of weeded it down to maybe 1 or 2 a day, and then after a while, you didn't even need it because you wasn't hurting. And as far as the pain, I haven't had near the pain that I had 3 weeks ago.
I sent you home with 3 exercises.
Mm-hmm.
1 was for your neck and the 2 were for your back. On an average, how often were you able to do those exercises?
I try to do them like 3 times a day. Yeah, I have a lumbar pillow,
Mhm.
and I got a kitchen chair, that's straight up chair.
So you are using the lumbar roll?
Oh yeah, yeah.
So-
I can tell a big difference like right up here. I don't know what it is, but this made this feel better.
So let's start off with your back pain. That was the worst pain. Before we did the exercise and now, how much how much better is it as compared to before you started doing the exercises?
I would say from 3 weeks ago or so compared to now, I'm easily 90 to 95% better than I was 3 weeks ago.
Okay, and how about your elbow pain? How much better is your elbow pain
Great. Those
as
don't-
compared to before?
Yeah, they don't even bother me at all. 6
So
to 8.
how much are you taking now, those pain
In a
pills?
5-day period of a work day, I'm down. I could, in 5 days, 40 hours, I could probably take 2 in the whole 40 hours. I cannot believe just doing something that simple, would make me feel that much better. I wouldn't believe it.
I see that you are sitting upright now.
It feels better. I've caught myself doing that because my wife said something to me that you look like you're sitting weird. I'm not doing however you want to call it, slouching. Or whatever. Yeah, she said I can tell you, but if I slouch now, that hurts.
Right.
So if you don't sit up straight,
So you have learned now.
Oh yes, yeah, you could tell.
That is just a very simple one directional movement, but does that bother you that it is so simple? How can it work? Does it make you
It makes you skeptical.
you skeptical?
Yeah, you kind of like, I'd have to see it to believe it, or
Right.
Yeah, you wouldn't think that. You'd like, no, it's got to be more to it because
Yeah.
the type of pain you're feeling,
Mm-hmm.
you're just brought up and raised to know that there's something wrong, and if it hurts that bad, you need something, I guess, powerful to help it or something. I don't know what you would use term-wise, but
Right.
you need something different to help it than just something like that.
Right.
Any factory worker will tell you, if I'm hurting this bad, there ain't no way that's going to cure me. It just
Right.
ain't going to happen.
So what do you make of now that you are better with such simple exercises?
What do I make of it?
Mm-hmm.
I'm glad I feel better. I'm not in pain,
Yeah. Yeah. Cool. All right.
I'm definitely glad it helps. I mean,
Right.
versus,
No, are you surprised
oh,
that
yeah,
such a?
versus getting hooked on some kind of pain medicine,
Mm-hmm.
That's one thing that's kind of, I wouldn't say scares me, but I just think that's a racket anyways. They just string you along and take your money, and they're all in cahoots. Somebody's making money with me, so,
Yeah.
and they're
Yeah.
using me as and I don't like that.
Right. Right. You are dependent on the pills.
Well,
and
yeah.
and the healthcare system.